Hi everyone, my name is Yetunde Bernie Somotosho. I'm a PGY3 internal medicine resident at the Chicago Medical School Medicine Program at Northwestern Hospital McHenry. I'll be presenting the case of Gorham's disease, massive osteolysis of the jaw. To introduce this case a little bit, Gorham's disease, also called Gorham's-Strauss disease or vanishing bone disease, is a very rare destructive skeletal disease that results in spontaneous and progressive destruction and osteolysis of bone and consequent replacement with fibrous tissue. The rarity of this disease continues to make it a diagnostic dilemma. I'm presenting the case of a 65-year-old paraplegic male with other comorbidities and a complex medical history that presented to our ED with severe right facial pain. On physical exam, he had hyperesthesia and severe pain, severe tenderness and palpation of his face, and there were multiple dental decay noted, but no signs of abscess or acute infection. A CT of the face was obtained, and it showed extensive osteolysis of the right maxilla as well as the right orbital floor, extending to the pterygoid plate and the right zygomatic arch, the whole part of his right nasal bone and anterior aspect of the right temporal bone at the level of the temporomandibular joint were also involved. So these massive areas of destruction were noted to be replaced by fibrous tissue. The patient was notified of the findings, and then we proceeded to obtain biopsy of this right anterior wall. This revealed spindle cell proliferation with dense fibrosis. Um, they were arranged like focally in the storiform pattern and with mixed inflammatory infiltrate and giant scatter cells. This led to a diagnosis of Gorham's disease. Um, However, because of this patient's comorbid conditions, his age, he decided not to pursue further treatment, and then he was later discharged to hospice care. So, Gorham's disease is characterized by uncontrolled proliferation of the standard thin-walled vascular or lymphatic channels within the bone, leading to bone resorption and consequent replacement with angiomas and fibrosis. The etiology is still unclear up to date. However, there's been several hypotheses, including high circulating osteoclastic precursors like the rank L, um, interleukin 6 induced bone resorption, possible thyroid hormone involvement. A lot of these hypotheses have been placed. However, till date is still regarded as a diagnosis of exclusion after a lot of other etiologies involving the bone has been excluded, including angiosarcomas, parathyroid hormone disease, and so on. Um, the definitive diagnosis is still established via biopsy, which would show presence of angiomatous tissue, absence of cellular atypia, and then it must be negative for any underlying neoplastic or metabolic disease, any immunologic disease, infectious disease, or hereditary etiology. So once all those other etiologies have been ruled out, and there's definitive biopsy results showing this angiomatous tissue and fibrous tissue replacement of bone matrix, then we can diagnose Gorham's disease. There's still no standard treatment available. However, we've used bisphosphonates, anti-resorptive therapy such as bisphosphonates, and radiation therapy, interferon alpha. These are varieties of medical therapies that have been used so far. In most cases, though, surgical treatment is preferred or done, um, requiring lesion resection, bone reconstruction using graft or prosthesis. We still don't know about the prognosis. It ranges from, very good prognosis to poor outcomes, because this disease can actually have like fatal complications, especially when it involves like the cranial bones or the ribs. Sometimes people can come with complications about pleural effusions, um, with pneumothorax and all that stuff. And sometimes if it involves the spine also, people also come with compression and some other complications that can be life-threatening. The diagnosis is still, like I said, a diagnosis of exclusion, and should be considered in the differential diagnosis of osteolytic lesions. Early treatment is very necessary to arrest the progression of this disease and to prevent devastating complications. I have attached here the imaging findings. You can see on the bottom left hand corner the corona section of the CT face. You see the whole right side, it's pretty much lysed. All the bones involving the zygomatic arch, the mandibular bones are kind of all destroyed. And then on the left side, I have attached a histopathology slide, just showing how the bone matrix and the cells have actually been destroyed and now replaced by connective tissue. So this is very typical of Gorham's disease. Thank you so much for listening. Have a good one.